Hello, good morning or good afternoon, everyone. A very warm welcome to you and thank you for joining us today. Welcome to our webinar in collaboration with Kent County Council. Today's topic is opportunities in the healthcare and life sciences sector in Malaysia. We will hear from our esteemed speakers about the healthcare and life sciences market and also the opportunities for UK companies to participate in the upcoming virtual trade mission to Malaysia later this month, which also includes business matching with local stakeholders. My name is Phoebe Nonis, Senior Manager for Trade Services from the British Malaysian Chamber of Commerce, better known as BMCC, and I will be your MC for today. We are delighted to have with us the Trade Development Manager from Kent County Council, Mr. Steve Sampson, to give his opening remarks. Steve, the floor is yours.
Great. Good morning or good afternoon, everyone. I really love it when you can say that with international events. I'm just going to quickly share one slide with everyone. As Phoebe said, my name is Steve and I work for Kent County Council in the small trade development team, and we do various activities to help our local businesses with export opportunities across the world. And we're very privileged to be working today with the British Malaysia Chamber of Commerce on a program a virtual trade mission program through our SEED project, which stands for Southeast Export Development. And that's a program funded by CELEP, which is our local enterprise partnership, and brings together the areas of Kent, East Sussex, and Essex in the UK, as you'll see from the map there on the slide. It's a program of activity that's running various virtual trade missions across the world for some of our key sectors, so health and life sciences, digital and creative, and also food and drink. And we've been working with colleagues in all kinds of different markets across the world. And today the session is focusing on opportunities in health and life sciences in the Malaysian market. We're really excited to be hearing from some excellent speakers this morning who'll be sharing, or this afternoon, depending on where you're joining us from, who'll be sharing their insight into that opportunities in the market. So we'll be kicking off in just a moment with Bhavna Vishwakarma from Department for International Trade and the British High Commission in Malaysia. She's going to be talking about the healthcare and life science sector in the country. Then we've got Nolela Hatta Anta from the Medical Device Authority and from the Ministry of Health in Malaysia, so the regulatory side of getting products into market. And then finally from Alan Chin, who'll be from Pharmaniaga, who'll be talking about the healthcare distribution system in Malaysia, which will be really interesting, useful information. Without further ado, really, I just want to wish everyone a really good webinar this morning. I think we're going to kick off quickly with Phoebe again, who's just going to talk a little bit more about the British Malaysian Chamber of Commerce, and I should say there'll be opportunities for participants to answer questions at the end of the presentations as well. And I should just mention that the session will be recorded as well for colleagues that weren't perhaps able to make the session today, or if you want to review some of the information rather than taking too many notes this morning or this afternoon. So thank you very much, and I'm going to hand back to Phoebe. Thank you.
Thank you, Steve. That was a wonderful introduction to our webinar. Before we go into the presentations, I'd like to give you a short overview of the BMCC. We are a bilateral trade organization formed in 1963. We have a mix of around 230 UK and Malaysian companies. The BMCC is also a member of BISIA, which is the Britain and Southeast Asian network of 10 chambers. And we are also a member of the global network of British Chambers of Commerce in the UK and worldwide. There are 4 pillars of the chamber: networking and events, We have over 40 events a year, a mix of business and social events, and also physical and virtual. Plus, the second pillar is branding and exposure. This is done through our digital platforms, partnerships, and also sponsorships. Third pillar would be our government advocacy through our sector committees and interest groups. We currently have an energy committee, 2 education committees, and we are also in the midst of setting up a healthcare committee. And final pillar is trade services, which is where I sit. We support UK companies entering the market by providing bespoke services. This includes B2B matching, organizing events, trade missions based on your needs. These are some of our member organizations. Join our network. And here are the contact details for the trade team. Please feel free to get in touch if you have any questions at all, or you can also visit our website. Thank you. Coming up, we have 3 interesting presentations from our respected speakers. We encourage you to ask questions in the Q&A box instead of in the chat box. Please also state which speaker your question is for, and we will attempt to answer your questions if time permits. Our first speaker is from the Department for International Trade Malaysia, as Steve mentioned. We are pleased to welcome Ms. Bhavna Vishwakarma, the Trade Manager for Healthcare, and she's based at the British High Commission in Kuala Lumpur. Bhavna will be presenting an overview of the life sciences sector in Malaysia. Over to you, Bhavna.
Thank you, Phoebe. Hello, everyone. I'm just waiting for my slides. Thank you. So hello, everyone. I'm Bhavna Vishwakarma, as Phoebe mentioned, the Trade Manager for Department of International Trade at British High Commission in Kuala Lumpur. I'll be talking about the market overview in Malaysia for healthcare, which will include pharmaceutical, medical devices, and digital health. So starting with an overview of Malaysia, just to touch upon some trade figures, the GDP growth for Malaysia has been around 2.76 approximately per year for over the last 5 years. The export from UK to Malaysia has been 2.7 billion pound, and imports to UK have been around 2.4 billion pound. And this is the latest data from quarter of 2021. It is ranked 12th globally on ease of doing business by World Bank Group 2020. Second most developed and competitive country in Southeast Asia, and likely to achieve a transition to a high income economy between 2024 and 2028. And Malaysia, if you look at the map, we have 3 parts here. One is Peninsula Malaysia, then 2 islands, Sarawak and Sabah. Next slide, please. So talking about the healthcare sector here, if we look at the market size of the whole healthcare sector, it's around 23 billion pounds. It is expected to be 23 billion pounds by 2027. The cost of healthcare comparative to US and UK is around 40% lower. And Malaysia tends to promote a lot of medical tourism to Malaysia, and has a good private sector offerings and public sector offerings in that sector. The factors contributing to this market are aging population, rising affluence, and increase in life expectancy in Malaysia. The healthcare system is 2-tiered, government and private sector, and they are in parallel. So government, the Malaysian population is covered 80% by the under the universal health coverage, and 80% of the people go to the public or have access to the public healthcare system. Around 30% approximately pay out of pocket for private healthcare through private sector insurance. It is a great structure in place with world-class investments, in hospitals, diagnostics, and digital health. In terms of human resources, clinician, nurses, and paramedics are here with good quality training, and have been educated in Malaysia or overseas. Coming to the third sector, which is on telemedicine, and especially after COVID-19, we have seen a massive adoption of technology in healthcare in terms of digital. So the Ministry of Health did a massive campaign through their app, which was supposed to be Trace app for COVID-19 patients. Then vaccination was again through this app, and it was a massive program which had almost all a majority of population covered through that. Telemedicine, and again, like most of the countries, Malaysia again adopted a lot in terms of telemedicine, and most of the private sector and public sector hospitals were able to provide telemedicine services during COVID. The private hospitals have also upgraded and adopted new technologies, not just in terms of telemedicine. They have also been able to provide virtual assistants, virtual consultations, and providing medicines, pharmacy services to people during this time. What we are expecting is that there will be an adoption of new digital healthcare business models. I will talk about it a little later in my slides about how Malaysia is moving towards a greater digitization. Can we have the next slide, please? Thank you. In terms of disease prevalence, if you look at Malaysia, then NCDs are very prevalent here, and NCD related diseases are within the top 5 causes of death. If you look at this charts provided by Department of Statistics Malaysia, this is a comparison between 2020 and 2029. So heart diseases are the primary causes of death here in Malaysia, and so are cerebrovascular diseases. If you look at the oncology data, then lung cancer is the highest prevalent type of cancer here in Malaysia. Malaysia also is expected to become an aged nation by 2035, and a lot needs to be done in terms of a healthy aging campaign that UK runs in providing good care for aging population of the country. Can I have the next slide, please? Thank you. So looking at the pharmaceutical market and medical devices, the size of the market is approximately 2.9 billion pounds, and the growth rate is a little over 9%. The market is dependent on imports for majority of its products, especially the innovative products and complex molecules. Looking at the market segment, prescription, over-the-counter, traditional medicine, health and food supplements take up the majority of the segments here. And health and food supplements seem to be increasing. In terms of medical devices, the size is around 1.2 billion pounds. The growth rate is a little over 16%. Malaysia is the largest producer of gloves, or one of the largest producer of gloves. And diagnostics and medtech are driven by aging, increase in life expectancy, and growth of NCDs. So because of this, the diagnostics and medtech equipment and devices are seeing an increase in the demand in the market. Increasingly also, the studies or various studies have suggested that Malaysians are taking approach of wellness and disease prevention rather than treatment. So there is this take up of health and food supplement, or being aware of what is needed in terms of preventing certain diseases in future, and diagnostics and follow up on their regular health checkups is also there. Can we go to the next slide, please? In terms of digital health, more than 2 million people use these digital platforms. So we have multiple platform providers here in Malaysia across the value chain, from booking a doctor to digital pharmacy. This is outside hospitals. Hospitals, private and public, do have certain amount of digitized services, which is provided through their websites and platforms. The National Fourth Industrial Revolution policy focuses on digitization in healthcare. There is a push from the government for including and inclusion of digital technologies in expanding the healthcare services in Malaysia. So on the right-hand side, on my right-hand side, the appointment booking, teleconsultation, prescription drug free delivery was something that we were looking at before COVID-19 and while COVID-19. But the market has evolved to some extent, and now we are looking at patient-centered care, precision medicine, especially in oncology, virtual health assistance for majority of services that are being provided, and integrated data health platforms. Integrated data health platforms provide a vast variety of wellness services also, and can be incorporated with corporates to provide these services to their employees and give them access to a lot of services which is beyond inpatient or outpatient insurance coverage. Can I have the next slide, please? The key agencies here in Malaysia for healthcare sector are Ministry of Health, which is the key regulator. They also are the largest procurement agency when it comes to pharmaceutical and medical devices, because the Malaysian system is federal system where Ministry of Health does the procurement for almost all public health hospitals here. We have National Pharmaceutical Regulatory Authority, which approves all the drugs that are sold in the market, and the application can be done online also. Medical Device Authority approves all the medical devices and medical technology or equipment that are entering in the Malaysian market. I've also mentioned the Malaysian Health Travel Agencies because this is another organization that promotes health tourism here in Malaysia, and Malaysia is increasingly trying to increase the medical tourism in the country, and this organization helps private sector hospitals to reach out to various patient bases across the world. In terms of digital health, the Ministry of Health together with Futurize has launched an online health service regulatory lab, OHS regulatory labs, for the evolution of a regulatory framework for online healthcare services in the country. This happened a couple of weeks ago, and the website provides information on how the companies can apply for being included in this program. Next slide, please. At DIT, we also have what is called the Export Support Service. Now, this service here has support services planned and designed towards helping high export potential SMEs from the UK. What it provides is one-on-one consultations, which is having an advisor, market advisor based out of DIT, which who will provide tailored expert advice for region and country market. Off-the-shelf market intelligence. In this service, the ESS provides access to up-to-date information, market intelligence, and market and sector-specific database series of on-the-shelf market or off-the-shelf market reports and publicly available data. Overseas referral network is another service that is provided by ESS, and this is focused on providing a list of private sector providers in the country that can help in range of services, including market research, translations, trading environment advice, and negotiation support. For reaching out to the export service, the email address is provided, and you can also learn about the local offices in the UK through the website link which is provided here. Can we go to the next slide, please? In terms of resources, the DIT has commissioned a report last year in 2021 on the digital healthcare and digital health landscape in Malaysia. This report will be published in the public domain in coming weeks. And you can also reach out to the BMCC website to get the information on this report and the link to this report. Next slide, please. So thank you. If you want to get in touch with me, my email ID is provided here. I'll be happy to take your questions at the end of this webinar. Thank you, Phoebe. Back to you.
Thank you, Bhavna, for that excellent presentation. Now, moving on to our next session, we are delighted to have with us today Juan Norlela Hatta from the Medical Device Authority, MDA, under the Ministry of Health, Malaysia. Juan Norlela is the Senior Principal Assistant Director and oversees the medical device industry facilitation activities. Today, Juan Norlela will be sharing an overview of medical devices, the acts and regulations, and also on the registration of medical devices. Over to you, Juan Norlela.
Okay, good morning to everyone. Thank you, Phoebe. So let me start with my session for today. I will share with you on the medical device regulatory system which has been implemented in our country, Malaysia. Okay, next slide, please. Okay, so as you see on the slide, in Malaysia, there are 2 acts that have been passed in Parliament of Malaysia that are related to the control of medical device and its industry in our country. The first act is the Medical Device Authority Act, or Act 737, that gives power on the formation of our office, which is Medical Device Authority, and the appointment of our board members. The second act is Medical Device Act 2012, or Act 737, that gives power or enabler to us in regulating the conformity assessment body, which is the third party like notified body in European country. This CAB playing role in conducting the conformity assessment procedure for the purpose of medical device registration and establishment licensing. This act also regulating the user who is using the medical device on the third party. Okay, under our act, there are 4 types of establishments who involved in the supply chain of medical device, starting from importation, placing in the market of the medical device, and also exporting out the medical device from Malaysia. There are 4 types of establishments that are subject to the establishment licensing with MDA. There are local manufacturer, authorized representative of the foreign manufacturer, distributors, and importers. Okay, next slide, please. Okay, based on hierarchy, we have on the top, which is our Act, Act 737. Under this Act, there are several regulations that have been gazetted. The first regulation is about the pre-market requirements. The second regulations prescribe the requirements on registering the medical device advertisement with MDA. The third one highlighting the duties and obligations of the establishments who has in place the medical device in our country. Under the Act regulations, we do also gazetting the exemption orders. Okay, under the orders, the acts and regulations, MDA also do publish the circular letters and guidance document to prescribe more detail on the regulatory requirements. Next slide, please. Okay, the first regulation which prescribe on the pre-market requirements, which is the Medical Device Regulation 2012, that has came into effect on last 1st July 2013. Under this regulation, it's prescribed the medical device registration requirement under the Section 5 of Act 737, the establishment licensing requirements under Section 15 of Act 737, and also the registration of conformity assessment body, which is responsible to perform the conformity assessment procedure for the purpose of medical device registration and like establishment licensing of establishment. Okay, next slide, please. Okay, we has gazetted the medical device advertising regulations in the year 2019. and this regulation has came into effect on the 1st July 2020. As I mentioned before, under this regulation, how to register the medical device advertisement has been prescribed and detailed out under this regulation. Okay, the next regulation is touching on the duties and operations of establishments who has putting the medical device into Malaysia market. Basically, these regulations highlighting the post-market surveillance vigilance of the establishment. Okay, next slide, please. Okay, we have 3 orders that have been gazetted under our Act. The first exemption order is the highlighting the extension of the transitional period for registering of medical device with MDA. Okay, under the second exemption order 2016, the certain medical devices are eligible from registration with MDA. The medical devices, example, the medical device, special access medical device, custom-made medical device, medical device for clinical research purposes, medical device for the purpose of education and demonstration are eligible to obtain this exemption. And also the establishment who are dealing with this type of medical device are eligible to get exemption from the establishment licensing requirement. Okay, under this order, it provides exemption for all Class A medical device from conformity assessment procedure by the CAB, so that all Class A medical device can be directly registered with MDA without the involvement of conformity assessment body. Okay, the third order, which is the Medical Device Declaration Order 2017. Okay, due to non-corrective contact lens do not meet the definition of the medical device, initially, this type of medical device is not under the purview of MDA. So by gazetting this Declaration Order 2017, all contact lens, regardless they are for non-corrective or corrective, are now under the purview of MDA and subject to registration and establishment license requirements. Okay, next slide, please. Okay, all circulars letters that has been published by MDA and all guidance documents are accessible via our portal. You can access and download these documents, legislative documents, with the URL address stated on below of my presentation slide. Okay, next slide, please. Okay, MDA will also publish guidelines to guide all establishment, to guide them on how to apply for the medical device registration, for the IVD registration, for the combinational product between drug medical device and medical device drug combination product. Okay, previously, for all COVID-19, this COVID-19 has been given approval for under the special access for the professional use, but for the self-test, MDA has given approval under the conditional. But now all COVID-19, all meaning that professional and self-test are subject to registration with MDA, and we has published the guideline for the purpose of registration of COVID-19 IVD test kits with MDA. Okay, the last guidelines touching about the re-registration process of registered medical device. Okay, during the first registration, the validity period of medical devices given is only for 5 years. Okay, so that after the validity period ended, all registered medical device shall go for the re-registration process. So MDA has published this guideline for the purpose of re-registration of registered medical device. Okay, next slide, please. Okay, so as an overview of the regulatory framework, because MDA is adopting the WHO regulatory framework, so our regulatory framework cover from the stages of pre-market, placement on market, and also the post-market. During the pre-market assessment, it is an obligation of the legal manufacturer of the medical device to ensure their products conform to essential principles, safety and performance of medical device. They also are responsible to establish the quality management system from manufacturing their product, and then they are responsible to collect the evidence of conformity and compile all documents. The third party or the conformity assessment body is playing their role to verify the evidence of conformity that has been compiled by the legal manufacturer. During the placement on market stage, either the local manufacturer of the locally manufactured product or the authorized representative of the foreign manufacturer are responsible to apply for the medical device registration with MDA. Okay, in the medical device supply chain, the importers and distributors are playing their role to comply and ensure the compliance to the GDP, or the full name of the GDP is the abbreviation for the Good Distribution Practice for Medical Device. And also the importer and distributor may be appointed by the registration certificate holder to do the advertising of medical device with MDA. Okay, these 4 establishments are subject to possess a valid establishment license with MDA. In the post-market stage, establishment whoever has placed in the Malaysian market the medical device are subject to monitor safety and performance of their products, to carry out post-market obligations in terms of complaint handling, field corrective action, and recall activities. Okay, as mentioned previously in my slide, the usage and maintenance of the medical device that has been used on the third party under our act, there is a provision for the users that they are responsible to use, maintain, dispose of medical device appropriately. Okay, for the designated of medical device, but until now, there is no medical device that has been gazetted as designated yet. But I would like to highlight, there is a provision for the user who is dealing with the designated medical device in future. They are subject to apply for a permit with MDA. So MDA is monitoring the compliance to requirements and takes appropriate actions in accordance with the provisions of the law. Okay, next slide, please. Okay, as I highlighted, the requirement on the registration of medical device, we have the provision under our parent act, which is under section 5 of Act 737. And it is anyone who contravenes subsection 1 commits an offence and shall on conviction be liable to a fine not exceeding 200,000 ringgit or to imprisonment for a term not exceeding 3 years or to both. Okay, next slide, please. Okay, this slide shows the conformity assessment procedures for the purpose of medical device registration with MDA. There are 4 types of conformity assessment elements, which is the responsibility of the legal manufacturer to compile the quality management system, QMS, post-market surveillance system, the technical documentation and declaration of conformity for the purpose of medical device registration. And then either the local manufacturer or the authorized representative of foreign manufacturer will appoint the local registered CAB to review the compilation of evidence of conformity. Then, upon completion of conformity assessment, once CAB satisfied with the compliance to all requirements, they will issue this conformity assessment report and certificate. This report and certificate will be uploaded in our online MEDCA system during the registration application made to MDA. Next slide, please. Okay, this is summary. This is summary of the requirement for registration of medical device with MDA. The party who is responsible for submitting the medical device registration application with MDA, either the local manufacturer or the authorized representative of the foreign manufacturer. Okay, during submission made to MDA, they has to upload the submission of a CSTT common dossier template, the declaration of conformity drawn by the legal manufacturer, and also the technical documentation to demonstrate the compliance on the quality management system and post-market surveillance. So, upon approval, the medical device will be put in the medical device register so that public can access to the information of the for the registered medical device in Malaysia. Next slide, please. Okay, this is the flow, the process flow for the medical device registration. Okay, the legal manufacturer has first to determine whether the product is a medical device or otherwise. The legal manufacturer is responsible to classify the risk, the risk of its medical device, and then because of our system in Malaysia allowing the grouping of medical device, so that the applicant is allowed to submit the registration in the grouping form either in the system set family. Okay, so this will facilitate the medical device industry so that they can save costs in terms of the medical device registration fees imposed. Okay, so it is the duty of either the local manufacturer or the authorized representative of the foreign manufacturer to appoint the CAB to conduct the conformity assessment procedure. Okay, once obtained the CAB report and the CAB certificate, the AR and the local manufacturer can proceed with the applying for registration application with MDA. Okay, once receiving the application, at the back end stage, MDA officers will evaluate all application received, and the registration of medical device are subject to payment of fees with MDA. Okay, once application is completed together with the fees and MDA has conducted the evaluation on the application, we will issue the registration certificate. And the validity of the registration certificate is for 5 years. Okay, next slide, please. Okay, as I mentioned, on the control over to all COVID-19 test kit for all professional use and self-test effective from 1st February 2022, all COVID-19 test kits are subject to registration with MDA, and MDA is no longer issuing or granted the permission under special access route and the conditional approval route. Okay, so in facilitating this registration of COVID-19 test kit, the applicant are eligible to obtain exemption from the undergo the conformity assessment procedure carried out by the registered CAB, they can straight away submit the application to MDA. Okay, next slide, please. Okay, I sincerely appreciate your attention today. With that, thank you so much for listening to my presentation. Thank you.
Thank you, Puan Nurlela, for the great presentation. Very detailed. Thank you. And last but not least, we are pleased to have with us today Mr. Alan Chin from Pharmaniaga, Malaysia's leading integrated pharmaceutical provider. And he will be talking about the healthcare distribution in Malaysia. Over to you, Alan.
Thank you, Phoebe. Good morning and good afternoon, everyone, wherever you may be. So I'm just going to be mindful of time, and I'll be breezing through about maybe 12, 13 slides, and feel free to ask any questions later on. So a little bit about myself. I've been in the healthcare industry for more than 20 years, in specifically for hospital management, as well as pharma lifecycle management and distribution management. So I have the deep knowledge of the healthcare landscape and industry in Malaysia, whether it's distribution or it's lifecycle management or sales efficiency and operations excellence. Yeah. So a little bit about Malaysia. We've got more than 140 government hospitals, and to match that, more than 400 private hospitals and medical centers in Malaysia. Now, the network of hospitals are also served by an additional 1,500 plus government health clinics that's located in more of the outskirts and rural areas all over Malaysia, and about 8,000 plus private clinics with 2,000 over pharmacy stores. So you have got the government channel, the private channel, and the trade channels as well to consider if you are looking into expanding into Malaysia. Now, a little bit about the licensing and the registration for pharmaceutical and consumer health products. I know there was some questions earlier on about this, but just to give you a perspective, right? If you wanted to sell something today, you would have or should have started the registration process 5 years ago. Okay, that speaks of the time it's required from the R&D to registration all the way to marketing that particular product. Let me just go through with you. For those of you who are pharmacists and who have a regulatory or quality background, this will be very pertinent and important to you. Always look at distributors or potential partners or affiliates that carry these certifications and licenses as a very minimum requirement. Yeah. And just to cover a little bit more on the extensive network, distribution network in Malaysia, as was pointed out earlier, there's 2 geographical land coverage, East and West Malaysia. The one on the left of the screen will be West Malaysia, on the right is East Malaysia. Now, there are also segments where there is high volume of patients, high concentration of hospitals, mainly in the main cities and towns. And there are also rural areas that you see the names of the smaller, I would say, counties as well, equivalent to counties in Malaysia, or what we call states and provinces. It is served by potential distributors that have got this coverage and reach. Okay, primarily the mode of transportation that is delivering the products, the pharmaceutical products or medical devices, is by land to most areas, except for when we send it over to East Malaysia, where it has to be either by sea or air flown in to the airports in this Kota Kinabalu and Kuching. It is also supported by boat to a certain extent to the interiors and the rural areas of East Malaysia, and 4x4 vehicles as well. Interesting fact, for some of you, even Malaysians who do not actually know this, Pharmaniaga, we actually do rely on horses as well to deliver to all the way to the interiors where even a 4x4 is not accessible. We have to use a horse to make sure that particular box of medical supplies reaches that clinic that serves a community of 100 or 200 people. Okay, so route to market in terms of what are the where are the healthcare players located, or the HCPs located? Of course, you got the pharmaceutical channel, you got the medical device, government sectors and hospitals, right? If you are looking into penetrating the market, the main HCPs or the key opinion leaders, KOLs, would be predominantly located in the government hospitals. And they also usually practice in private hospitals as their second practicing place. If they have, if they practice in a very niche subspecialty, where a handful or maybe less than 50 such specialists is available, then they will be visiting many more hospitals once a week, once a month, or things like that. Yeah. So these are the key points that you should be considering as well. And we've got pockets of institutions or government institutions like local city councils that do purchase medications on behalf of their employees as well. So embracing innovation, I think this is something that also was mentioned earlier on in some other slides. This is something that is growing rapidly in Malaysia. Many pharmaceutical houses, brands, have actually started embarking on digitalizing their omni-channel approach, where their reps are really not just having face-to-face calls, not just because of the recent pandemic that we are facing, the endemic situation now, but it's more of leveraging on the new tech-savvy consultants. They prefer to see things visually and to save their time. They have 30 minutes consultation with a patient, they got 2 hours surgery with a patient, and they only have that 1-2 minutes to spend to speak to a rep sometimes, right? So instead of speaking to a rep and the rep waiting for hours just for that one appointment, adopt and embrace digitalization, where you can send across messages via email or get them to log in and get them to interact with you online as well. The marketplace in Malaysia is quite unique. I would say it's very dynamic in terms of the offering, yeah, in terms of what is the business demands. It's generally a tender-driven market for the branded products that has got very minimal generics. It is very competitive in that sense because we have a very good mix of branded and generics in the market. Yeah. But be mindful of the government direction, where we are cautious of overspending on healthcare that will eat into the GDP expenditure. And in terms of competition, if you're looking to go against local mom and pop distributors or businesses, they would have probably some price advantage if, let's say, they can source their products from India or some parts of China. Yeah, so that's one concern. Compliance, mostly most distributors in Malaysia are qualified in GDP and GDP-MD as well. They are most of the time ISO certified in terms of management, and to a certain extent GMP if they have secondary repackaging and secondary redressing facilities within their warehouses. So this it relates to your importation. If you are importing anything into Malaysia and you are using a Far East pack, for example, where you manufacture for many markets so that you can gain economies of scale, you can do that from Malaysia, provided that you register the right product, the product inserts as well, the right makeup of the cartons and all that. And when it arrives in Malaysia, it has to go through this GMP secondary redressing, and it has to be released, batch released, before it's then sold to the market. Okay. So where to start? Basically, it's quite simple, really. Look for a reputable market research organization, such as a distributor that may have already the knowledge and network of sales personnel that speaks to the right target audience of yours. So that's where you look at targeting and segmentizing who are your KOLs, who are your prescribers, who are your pharmacy stores, where are your patients located, right? Do that market research and come up with a strategy, whether you want to go direct or indirect. So this is very common in manufacturing and CMO terminology. If you go direct to the market, would you have a sales team present? Would you have an organization or a legal business entity registered in Malaysia? If you prefer to go indirect, you can also do that as well, where you have consignment, perhaps goods sent over and shipped over to Malaysia and then get paid for it in a certain period of time. And whether you want to just focus on sales and marketing and let a distributor or a warehouse partner do the logistics parts for you. Okay, so these are very different elements and different scopes that Malaysia companies are capable to do. And then step 2, of course, engage these people and deploy your strategy accordingly, but not forgetting register your products and obtain the necessary licenses as well. Just to add on to some statistics, yeah. So these are some of the key principal cause of hospitalizations in Malaysia in government hospital, as well as the key cause of death, 10 cause of death, as well as the private hospitals as well. So you're looking at an aging population that is growing increasingly, right? As the population birth rate decreases from 2 something to 1.7 today, you're looking at a population that's moving from the 40s and 50s into the 60s and 70s age. And Malaysians are generally quite healthy. We have averagely about 72, 73, 75 years life expectancy. And moving along with that, the women have a higher life expectancy rate compared to the men. Okay. And for those of you, just information on the consumer health space, this is overall health supplements. Yeah, it is projected to be growing by a CAGR of 4% from 7 billion that we saw in the pandemic year 2020 to 9 billion ringgit. Yeah, this is in terms of ringgit. But do be cautious that some of these numbers may not be very solid, because as much as possible, all these research houses, they can get the information and analytics and the data. They won't be able to get the actual and accurate one, because there's always some players who do not prescribe to the data, or they do not share the data as well. Okay, but just something to look out for if you are interested to look at preventive medicine, that means supplements to prevent future diseases and all that. It's a good time and good opportunity. Ministry of Health is engaging more and more towards preventive healthcare. The health minister has recently tabled, and I think it was approved by the parliament, for anti-smoking bill in Malaysia, where any person that is born after a certain year can no longer purchase cigarettes. Okay, so that's one key initiative. So you can see that the seriousness of the government to embark on preventive medicine, it's very high importance. And just to finish off, this is news that came out today. The Health Minister Khairy Jamaluddin mentioned that, you know, perhaps the world population, there is about 1/3 that consists of Chinese and Indians, right? And in Malaysia, we have that. We have a fair mix of Chinese, Indians, and Malay population in Malaysia, as well as Westerners, or we'll say foreigners, residing in Malaysia. So we have got a very good dynamic and mix of culture, or mix of genomics that encourages a better mix of clinical trials. So if you're looking for, you know, engaging for clinical trials, perhaps do consider Malaysia as well. We are geared towards supporting it, and you know, we are one of the fastest countries in the world from the time of trial, from submission to the ethical review. It takes only 1 month. I think in some other countries that we hear of, 3 months, 6 months is the norm. But 1 month is certainly very, very fast. Okay, so I'll leave you with this information as my last slide. Thank you very much for your attention, and I hope I've been able to share with you as much as I can in the short period of time. Thank you.
Thank you, Alan, for your excellent presentation. Now we will move to the Q&A session. I know we've answered some of the questions already, so we'll try and go through this pretty quickly. First question is the supplier of outsourced activity, freight forwarding, trucking, and warehouse, appointed by manufacturers or ARs, need to comply to GDPMD? I think this one sounds like it's directed at Puan Nurlela. Would you like to attempt the answer?
Okay, so the answer is no, because these outsourcing activities is under the responsibility of the licensed establishment. So during obtaining the certification of GDPMD, they has to make declaration what are the activities that are outsourced to the third party. Okay, is it answering the question? It is not the mandatory for the company that involved in the outsourcing activities to have and apply for establishment license with MDA due to the main distributor or main importer has to first declare during they are obtaining the GDPMD certification with MDA. Okay, this is the answer to that question.
That's great. Thank you,
Thanks.
Puan.
Can I also add from a
Sure.
point of view of a distribution company, right? If you are in the business of freight forwarding or logistics, wanting to supply or provide your services to particularly medical device companies from overseas, of course, one of the requirements from these manufacturers, from these brands or these multinationals is to have GDP and GDPMD. This is usually one of the requirements. Just to name a few companies, Baxter or Fresenius or things like that, they do need some form of certification because what you're going to do for them is a part of a distribution network. You are a part of the supply chain, right? So where their goods are stored before it reaches the intended hospital or patient, they need to know that the quality is there, the license to carry these products is in place as well, and it complies with their own requirements. So a lot of times it's not just a part of MDA, it's also part of what those manufacturers are looking at.
That's perfect. Thank you both. Final quick one, I think, is does the supplement have to have halal certification? Who would like to take that one?
To my knowledge, it's not mandatory, but perhaps it's an advantage if you do have that, because looking at the population, you cannot discount the Muslim segment, where if you want to have supplements to be as your customer base, it will help. But I won't say 100% mandatory. It will help in terms of marketing and sales efforts there.
That's great. Thank you. Thank you so much, Alan. And with that, we've come to the end of our webinar. Thank you so much to our respected speakers for your valuable insights. Thank you also to the audience for your attendance and for your questions today. Our appreciation also goes to our partner, Kent County Council, for their contribution for this webinar. Thank you also to the amazing team at BMCC who have worked behind the scenes to make this happen. Enjoy the rest of your day. Take care and stay safe.